look after these patients. The senior therapists at our site were heavily relied upon because of their experience in working with this type of patients before. Like I said, even though we've never experienced that type of volume. Also, transporting these patients, because obviously as they were sick, we had to bring them for different tests, CAT scans, etc. It was very challenging to move these patients. Every time you would even move them, even when the nursing would turn to patients, their oxygen saturations would drop even with the slightest movements. So obviously bringing them from the ICU over to the CAT scan and stuff like that was very challenging. Also, we wanted to make sure as we were transporting these patients that, we weren't transmitting the virus. So we had to make sure our ventilators were properly filtered and stuff like that as well. I will say, though, the teamwork in the critical areas was outstanding. I mean, we had staff there that used to work there 4 years ago that were moved to different places and stuff like that. And I must say the teamwork really came together well by the time it was all said and done.
Okay. Tammy, how was it working for you as a nurse?
Well, I remember, Louise, the first day I walked into our unit, it was actually the CCU became the H1N1 unit.
That's right, the health sciences. Yes,
within a couple days. So, I mean, the place was transformed. And I remember the first time that I walked into the unit, and it was just like a war zone, as I heard somebody else describe. But there were people everywhere. The unit was filled with the sickest of the sick patients, and every patient was like that. And I know every time I walked into work, I would think of the song "Welcome to the Jungle," because that's what it felt like every day when you went to work. You never knew what you were going to have to face, and there were no breaks. You went to work for 12 hours, and you worked every bit of that 12 hours. But at the same time, even though it was very difficult work and it was very exhausting and everything else, it was very satisfying as well, because the team worked so well together, and management was there with us and listening to our needs and made sure the resources that we needed were there, and so you were able to do the job that you needed to do. So it was a very exciting experience too.
So what will be your lasting impression for this H1N1 experience? And I know we still do have some people in our ICU, so you probably are still dealing with these clients and families on a daily basis.
Well, that's true. And actually, after the pandemic was deemed officially over, that was probably the hardest time we had, because a lot of the support that we had got pulled, and so we had a couple of weeks where it was very difficult for us, but everybody, stayed true and kept doing their job. But I think the big thing, and I know many of the people I'm hearing talking today seem to be from a management perspective, so I guess I'm kind of talking to you guys, is I think what made our job easier on the front line was that management was listening to us and actually responding to what we needed. So if I remember one night calling Maria Tracy at night looking for, I can't even remember what it was now, and just being able to pick up the phone and call someone, and someone to say, "I'll take care of that and do that for you," so I could go back and take care of my patient, was, that I can't tell you what that meant. So, the entire team working together, and everybody, from nursing to RTs to doctors to everybody working together, and then management as well. I think that experience is what, we should strive for every day.
Absolutely. You've heard many stories from all parts of the region here today, and as the executive lead for pandemic, I too have many stories about Eastern Health, how we worked nonstop to get the public vaccinated in as an efficient manner as we could, despite the changing criteria, how we worked to calm the fears of the public by answering their many questions, and as Tammy and Merv have just talked about, how we cared for the sickest of the sick in our ICUs. There was never really a sense that the work required could not be done. It was always, what can we do? Who can we pull into this situation to get what needs to be done? Nobody really questioned why we were asking them to work in very different places. You heard it from Shelley, you heard it from Lori, you heard it from many people here today. They understood that the work that really needed to be done was Eastern Health's work, and they never questioned it. And I would ask you, if you haven't already had a look at the posters that are around in the organization today, which have the thank yous from the public. They've been in the paper. They've been on our internet. Jeanette from Communications has been trying to get that out so people will hear. It's about the work that we were able to do. It's about, you heard many people here today talk about how appreciative people were because we took the time to talk to them, to listen to them, and to provide them with directions. So there's very many memories flooded. As I read through the thank yous and the patient that was in ICU and the family were there and how one of our housekeepers, just had this caring attitude and knew exactly what to do instinctively, those are the things that flood back to people as you think about the experience that we've been through. We know Newfoundlanders are a caring people, and we are a caring organization, and many people in the public had not seen that side of Eastern Health. And I think that that's probably, as we've gone through the experience of pandemic, which will stay with me the most. It was a side of Eastern Health that publicly got acknowledged, that in fact many people inside who come to us for service do in fact receive that kind of care in the care that we provide. So really, I thank you for allowing me to carry out my role as commander. It's a role that I laugh at when I think about it. It's called commander. David started out by talking the EOC. It was the incident commander, and it was truly a rewarding experience for all of us, I think, that were involved. And as we sit and reflect upon what we were able to do and what we were able to accomplish, and as Jeanette and Susan and them have put this together, the teamwork that we were able to achieve as we went through this is an opportunity for us to know how we value each other and that we can work as this team and continue to go forward. Tammy had said that management was responsive to their needs. This is what we ultimately would want to continue as we continue on in Eastern Health. So, Vicki, are you there at the Health Sciences?
I am.
I'd pass it over to our CEO, Vicki Kaminsky, who would like to say a few words.
Thanks very much. Louise says that the role of commander doesn't come naturally to her. Anybody that knows her knows that's just not true. We were having daily conversations with the Minister of Health, and the last thing Louise would say to me before we walked into the meeting was, "Don't you say yes to anything until you look me in the eye. I'll give you the sign."
That's right. You didn't have to say that, Vicki.
And then, I think Terry mentioned they'd get a phone call at 3:45 in the afternoon. It's not because we weren't telling you in advance. That's just when we found out what we were going to do, and we'd have to go out and change all our plans. I was extremely impressed and certainly very proud to be part of Eastern Health through all of this. I think what we've heard, the teamwork, the adaptability, the flexibility, the opportunity to see people step outside their roles and to take on more and more tasks and to be able to do that with grace and aplomb and caring and consistency. And that's what I saw from every person that works at Eastern Health, even those that may not have been as affected by H1N1 as some of the rest of us. A personal story, the love of my life ended up sick, and he's a man. And so I said to him, "Suck it up, Buttercup, it's a cold." We went on like that for a few days until I woke up one morning and looked at him and thought, boy, he really does look sick. And said, maybe we better go to the flu assessment clinic. So we did. We took avail of that and went in, and so the doctor said, "So does he have a temperature?" And they couldn't talk. He'd lost his voice. And I said, "Well, low grade." So they stuck a thermometer in his mouth, which I didn't have at home, even though I'm a nurse. And they said, well, it's actually about 39.5, which is a pretty high temperature. And went on to tell me he had bilateral lower lobe pneumonia, he had H1N1, he had bronchitis, pharyngitis, and every other itis you could think of. And it was a good job he couldn't talk, because I know all the way home he wanted to say, "See, it's not just a man cold. I actually was sick." A couple nights later, though, we had to come back to Health Sciences because he wasn't getting any better. So we were in Emerge, and we saw what was happening on the front lines. And I saw the housekeeping staff who would come in and say, "Can I get you a cup of coffee? Do you want a muffin?" Not to me, but to everybody sitting there, and saw people working in some of the worst possible circumstances because of overcrowding and because of looking at trying to decipher who was really sick. And every single person did it. They did it gracefully. They were tired. They came back and did it again the next day, and it didn't matter if you were in the flu assessment clinic, if you were on the front lines, or if you were on the outside lines directing people to come back the next day and not be here today. So